Greetings all and welcome to Public Health Nursing. My name is Emily Glott and I am a registered nurse and adjunct faculty for the Department of Nursing at University of Sioux Falls. This is an audio presentation on Chapter 46 of the textbook Stanhope and Lancaster. I'm going to lead you through public health nursing at the local, state, and national level. So let's take a look at our objectives before we get started. Today we are going to offer some more definitions of public health. We've been doing that in this course. Some of this may be review, but I think review is good at helping us get our heads around what public health is and what public health nursing is. We're going to look at systems. We're going to look at public health nursing at local, state, and national levels. We're going to identify some trends in public health nursing and provide examples of public health nursing roles. We're going to differentiate some of the emerging public health trends, issues that specifically affect nursing. And we're also going to talk about some of the principles of partnerships in public health systems. So what are we thinking about when we think about partnerships? There's a good definition of partnerships right off the bat in your chapter. The Community Campus Partnerships for Health defines a partnership as a close mutual cooperation between parties having common interests, common responsibilities, privileges, and power. So one of the key things that I love about nursing, and public health nursing especially, is the concept of partnerships, working collaboratively with other agencies. So a nurse working in community, working with hospital nurses, a nurse working in community, working between agencies. And nurses are very skilled at developing, sustaining, and evaluating community-wide partnerships. This is taken right from your text, and I like to use these video presentations to really highlight what's important in the textbook. I know it can be lengthy and sometimes a little dull, but public health nursing at its core is very exciting and interesting. So let's talk about a partnership that USF has. So public health nurses are involved in activities of creating partnerships in many different ways. So a public health nurse could be a facilitator or a member of a partnership. At this time, USF has a partnership with Center of Hope. Center of Hope is a day center for people who are homeless or just experiencing difficulties in life, especially financial. The Center of Hope is an excellent agency that I've worked with for a long time. I hope you'll take a minute to go ahead and look at their website. I put that little link in there. You should go to the Get Help tab when you get to the home page of Center of Hope. The Get Help tab will drop down and give you an option to look at faith community nursing at the Center of Hope, where participants at the Center of Hope can get free medical advice and support from a registered nurse. So this partnership is extremely important to USF because we are able to impact the lives of vulnerable populations through Center of Hope. We are able to help with screenings, provide education, and spend time really immersing ourselves with a population suffering from all kinds of vulnerabilities, especially poverty. So hopefully we are helping Center of Hope. At the same time, Center of Hope is helping us by allowing our students to spend time at this valuable agency. And we've had this relationship now for as long as I've been at USF, and I hope it continues. Excellent example of how nurses in community develop relationships. I'm sorry, that went back to objectives. I'm going to this slide now. This slide is going to talk about the roles of local, state, and federal public health agencies. So what are these roles that local, state, and federal public health agencies need to be fulfilling? Number one, agencies need to make sure they collect and analyze vital statistics. Vital statistics are essential to public health. In particular, maternal and infant mortality serve as important indicators of the nation's health. So if you're looking at the health of your nation, your state, your county, you may bring up data regarding morbidity and mortality data, especially when it comes to maternal and infant mortality rates. Agencies are also required to provide health education and information to the population they serve. Another important role is receiving reports about and investigating and controlling communicable disease. So when we get to infectious disease and public health, I think you'll find that very interesting. It's one of my favorite aspects of public health. We'll talk about reportable diseases. We'll talk about what happens when a disease is reported, how that's followed. Agencies need to not only receive those reports, but investigate them and try to control communicable disease. One good example of that is direct observed therapy for, one important example of controlling communicable disease is directly observing people take their tuberculosis therapy. So another role is planning for and responding to natural and man-made disasters, okay? So people that are vulnerable already because of many different health risks become extremely vulnerable when there is a natural or man-made disaster. I think about the victims of Hurricane Katrina and their living conditions and issues with their health after that disaster. Also, public health agencies are called to protect the environment. We protect the environment because the environment is where people live, and our job as public health professionals is to reduce the risk to people's health by protecting the environment. So here's just a continuation slide of things, roles, responsibilities of local, state, and federal public health agencies. So also agencies provide services to populations at risk or populations with limited access to care. So in this course we'll talk about the Falls Community Health Center of Sioux Falls, South Dakota. This community health center luckily is housed within the Department of Health of our city and has a clinic that has a federally funded clinic that provides services for a sliding fee scale. Accepts insurances from some of the major employers of Sioux Falls, especially I'm thinking about the meat packing plant employs a lot of people who you probably would consider are working poor, and the health insurance provided at that meat packing plant is also a provider at the Falls Community Health Center. So folks with vulnerability because of income are linked with an excellent community health center where they can receive comprehensive medical care. So another important aspect of what agencies need to be responsible for is conducting community assessments. And in your community assessment chapter, we'll go through a community assessment. Part of a community assessment is a windshield survey or a windshield assessment, and each student does one of those. You can look at the details on LMS or certainly reach out to me if you have further questions. But we assess communities and populations just like we assess patients directly in their beds. The process is a little bit different, but community and public health nurses look at a group of people or an aggregate or a community or an environment from the perspective of assessment instead of just a one-on-one assessment. Public health agencies need to identify public health problems for at-risk and high-risk populations. There are populations that suffer more often from certain disease processes, and public health nurses and professionals are responsible to identify those problems and work towards resolution and providing for the best health care for all. Also, here's another concept of partnering and partnerships. So public health professionals need to partner with other organizations so we can provide the most care for the most people. So let's look at some history and some trends in public health. We've looked at these a little bit and touched on these before. But a person born today can expect to live 30 years longer than a person born in 1900. Medical care accounts for the 5 years of that increase. Public health practice, resulting in changes in social policies, community actions, and individual and group behaviors, is responsible for the additional 25 years of that increase. So historically, public health nurses were valued by and important to society and function in an autonomous setting. Public health nurses, early public health nurses, worked with population in the settings that were not of really interest to other healthcare disciplines or groups. Much public health service of the past was delivered to the poor and to women and children. And if you think about it, in the past, women, children, and the poor are people that do not have political power or voice. So during the course of the 20th century, public health responsibilities expanded beyond communicable disease prevention to occupational health and environmental health to include reproductive health, chronic disease prevention, injury prevention. Another trend is the emergence of Medicaid managed care. So many public health agencies were no longer providing personal health care services. Public health agencies began to shift emphasis from a focus of primary care to a focus on the core public health activities, such as community health assessment, community health planning. So they shifted at the time of Medicaid and managed care. Public health agencies shifted from providing services to individuals to looking at the broader scope of public health and providing services to agencies, to aggregates, to populations. As the 20th century came to a close, developments in genetic engineering, the emergence of new communicable diseases, prevention of bioterrorism and violence, and the management of the disposal of hazardous waste were emerging as additional public health issues. So throughout history, as these issues emerge that affect people's health and populations, these have become priorities to public health professionals. I'm going to pause for a few minutes and just let you read this slide. So let's move on and talk about some definitions of public health. C.S. Winslow's definition of public health said that public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort. The Institute of Medicine says public health is what we do as society collectively to assure the conditions in which people can be healthy. Public health nursing from the American Public Health Association says that public health is promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. The American Nurses Association says public health is population-focused practice that works to promote health and prevent disease for the entire population. So let's shift our thinking to the specific principles of the public health nursing specialty. The public health nursing specialty is population-based. Population-based assessment, policy development, and assurance processes are systematic and comprehensive. That means they're all-encompassing. All processes include partnering with representatives of the people. I like this one. This is incredibly important. So nurses do not do assessments without including the people they're assessing. We don't look at a vulnerable population and not ask the population what their life is like, what their reality is like, how they are living in community. So let's say that again. All processes include partnering with representatives of the people. I, for many years, attended the Homeless Coalition in Sioux Falls. And the Homeless Coalition is a group of interested people that gather together to lift up the concept of homelessness and to fight towards less homelessness in our community, obviously, but also alleviating the difficulties of people living in poverty. And what I really loved about that organization, and it still exists today, is that there were people who were homeless or precariously housed on that committee. So they sat right next to the physicians, epidemiologists, lab personnel, nurses, folks living in poverty and with homelessness sat right next to all of the other key people interested in homelessness. So another principle is that primary prevention is given priority. You should remember that because that is a very frequent test question in this course. The priority of the public health nurse specialty is primary prevention, and we've defined that in other slides. Intervention strategies are created to create a healthy environment, a healthy social, and a healthy economic condition in which people can thrive. This is a continuation of the 8 principles of the public health nurse specialty. So public health nursing practice is obligated to reach out to all who might benefit from interventions or service. The dominant concern in public health nursing is for the greater good of all people, or the population as a whole, not for the greater good of one specific person. Public health nurses are called to monitor the stewardship and allocation of resources so that we are giving our resources to the maximum support and supporting the population who needs it the most. The last one here is the health of the people is most effectively promoted and protected through collaboration with other members of professions and organizations. This slide just lifts up some of the scope and standards and roles of public health nursing. The National Public Health Performance Standards Program, I usually provide a link here, but there's a link to the CDC, and the CDC provides recommendations on interventions, health promotion activities to different state, local, and federal agencies. There's also evaluation instruments to collect and analyze data that you can use from this National Public Health Performance Standards Program. The thing that I want to make sure you know about this slide is that nurses specifically retain responsibility for knowing that all populations have access to affordable, quality healthcare services. That's really on nursing. Another slide sort of depicting the issues and trends in public health nursing. Remember that there has been a shift from last resort primary care in public health to the promotion and prevention of health issues. And so specifically, this raises concern about uninsured or underinsured people. We know that having insurance directly relates to the health of populations. Another trend is the trend of we have antibiotics, and the trend in early public health situations was that antibiotics were saving lives and prolonging life. Now we're looking at increased rates of drug resistance. And I want you to make another note on this slide. We have increased rates of drug resistance to community-acquired pathogens. So now we have superbugs that we don't have antibiotics for, and we have emerging infectious disease that we don't have immunizations for. Another trend is healthcare reform, which was the Affordable Care Act, and I have other presentations that describe the Affordable Care Act in more detail. For a couple of years it was the law of the land, and now affordable care does still exist, but it is somewhat controversial about how it will last and what it will look like if it does last. Another trend in public health nursing is affordable housing. There may be housing in a community like Sioux Falls, but it may not be affordable to those people that need it the most. And if somebody is not housed, if they do not have housing, that directly affects their health. Also trends in societal disparities where people of certain groups and vulnerabilities have poorer health outcomes. Okay, so here's a quick recall. This is a test question. So the shift from providing last resort primary care to promotion and prevention partnerships raises greatest concerns about what issue? So the answer here is answer C. So C, the needs of the uninsured or underinsured. So I agree, all of these, A, B, C, D, are all important issues. The public health shifts from being the primary care provider of last resort to developing partnerships to meet the health promotion and disease prevention needs of a population has raised particular concerns about available health care for the uninsured or underinsured. So what are the other trends in public health nursing? So behaviorally influenced issues, what they mean by this in the textbook is what are personal behavior and the behavior of populations, what are the issues that come to surface because of those things. So chronic diseases is an example of a behavioral influenced issue. Violence in society is an example, and substance abuse. Emerging infections. Some of the emerging infections are things like SARS, severe acute respiratory syndrome, H1N1 influenza, which actually was an issue about 9 years ago. We had an H1N1 flu epidemic. Another trend is unequal access to healthcare. So we may have excellent healthcare in the city of Sioux Falls or in the nation of the United States, but not everyone has access to it. And these are important trends to consider for public health nursing. Models of public health practice. I'm sure you guys have looked at the intervention model from the Minnesota Department of Health. I use it in my class. Many of us that teach public health use this model. I put a link so you can go to a live wheel model on the Minnesota Department of Health website. This model uses the 3 levels of practice. So systems is one level of practice for community health nurses and public health nurses. Community and individual family. I have a whole slide presentation on the wheel, so I'm not going to get into it that much, but just go ahead and take a look at it. There's other models. Another model is the public health nursing practice model from the Los Angeles County Department of Health. But for purposes of this course, I would just stick to the one intervention model. Get to know it. It will be tested upon. We'll talk about it in class. It's something that would be nice to incorporate into your final projects for public health. So let's look at some of our national health objectives in the United States. First of all, if we were going to look at national health objectives, the place to start would be Healthy People 2020. This is a platform for the United States for health objectives that is revisited every 20 years. And since 2020 is around the corner, we'll be revisiting that soon. I'm going to try to cut and paste a link into this slide right now because I meant to do that earlier, so that you can go ahead and try to visit Healthy People. So public health nurses can use Healthy People 2020 to identify unhealthy behaviors and develop strategies to improve their health. Public health nurses can organize the community to identify where health disparities exist. So I was recently asked to help write a grant at a school that I work as a volunteer nurse. So I work in a school district that does not have formal nursing care. And so there are a clutch of us that do volunteer work for the school. And the principal of the school, that doesn't have a lot of funding, was concerned about getting playground equipment. There's no playground equipment in their playground, or they have some old playground equipment that probably isn't up to standard. And so when I was looking at this, and she asked me to help her with applying for a grant, I did use Healthy People 2020 to gather some ideas about why a grant would be necessary. If there is federal money or donation money available for playgrounds, I wanted to look at what are the health indicators that would say that our school needs this playground. Well, I looked at determinants such as free and reduced lunch. I looked at obesity and overweight rates, and I was able to apply those to the grant, and we were funded for a new playground. So public health nurses have many functions. Public health nurses are advocates. So when I'm writing a grant to help provide for playground equipment for a lower socioeconomic school, I'm advocating. I'm hopefully lifting up folks who don't have a voice themselves by putting together data and asking for money to make change in a playground setting. Public health nurses can affect legislation. We have Nurses Day at the legislature every February in South Dakota. Some public health nurses act as case managers to manage care and make sure that people are connected with the resources they need. Public health nurses refer. They assess people's literacy, health literacy. Public health nurses are educators, or sometimes they're direct primary caregivers. Also, public health nurses ensure direct care services are available for at-risk populations. Other functions of public health nurses could be disaster management. I know this semester we are able to participate in a disaster drill, so we'll be practicing caring for individuals during a disaster situation. Public health nurses act as communicable disease control and can act as incident commanders in disaster management or communicable disease control. And public health nurses influence the levels of prevention. This concludes our PowerPoint presentation on Chapter 46 of Stanhope and Lancaster. Thank you.